Great.
Yeah.
So, as you know, I'm doing a cultural project about the Latin culture in America and how they view emergency medicine, as I'm an ER nurse. I work in a more rural ER, so we have lots of migrant workers. We have lots of people who only speak English. And we're trying to get a grasp on how Latin people in America view emergency medicine, if it's different than how you may have viewed it at home, if you had a chance to use an emergency medicine versus a primary care provider in Colombia versus what your choices are here. Can you talk a little bit about that?
Well, in Colombia, for example, the medical care is a lot less expensive than here.
Okay.
It is it's really like emergency room, and I can say for experience, I was in the emergency room about 2-3 years ago. For one night, I spent the night in the emergency room, left the next morning, and my bill was $400.
Oh my gracious, I bet.
Yes.
Yeah.
So
The population that I work with in Smithfield, in a rural area, I feel like they don't have primary care providers, and so they aren't doing maintenance care to stay healthy. I'm noticing that people come in on the verge of death. They'll wait. The more white, typical North Carolina population will come in with a cold, a toothache. You know, they'll come in for emergency reasons too, a car accident or a dislocation. But a lot of our patients that are the typical North Carolinian, that's white American, will come for primary care or less emergent care. And the Latin people that I work with, like I said before, will come in the middle of a heart attack or in the middle of a stroke, and they've never gone to the doctor before. They may have been symptomatic, but they're waiting and waiting until it's this huge crisis in their life. Why do you think that they do that?
well, I think that there will be a lot of reasons. I mean, I'm not 100%. You know, everybody has a different reason, but I think the migrant workers, basically, that's the one you're referring to. Some don't have papers, so I think that they're afraid to come out for just a simple cold or the flu, or because they don't have the papers, so they're afraid that they might be singled out and then they will be reported and reported. So I think that's one of the reasons. Another reason too is the language barrier.
Correct.
I think the language barrier is a huge factor. I did work at one point as a volunteer in one of the clinics in Raleigh, downtown, as an interpreter.
Is that where Greg Dolan worked as well? He used to do that.
I don't know exactly. That was through the cathedral, right behind the cathedral.
I think he did it as well.
The Catholic Church.
Yeah.
He might have done it too. I can't. We never crossed.
Right.
I did that for a while on Sunday afternoons, and I helped as an interpreter for the patients that came, and I was just really surprised for two things. One, the women they were very careful to say exactly what was wrong. I don't know what is fear or I couldn't figure that out. They were just, I really had to dig. I said, okay, but why do you think? I mean, is it that you are pregnant, or because you? And they will have a really hard time. So sometimes they will just very superficially will say what was wrong, but really they didn't know the symptoms. And I used to have to really ask them, but the doctor has to know it's okay. Whatever it is okay. That's how they're going to come out to a diagnosis or something. The other thing too was, I'm not talking about women. I remember going to, in the same place, I think Rex came with one of those cancer for screening units. And so I help a lot of the women. Again, it is education. They some of the women didn't know how to write, they didn't know how to read, to fill out these forms. So I help with the forms, and they were getting mammograms, and then but after that, whether the mammogram came positive, or it was hard to figure out where would they go, how to reach them, and what's next after. They will go through the mammogram. Some didn't want to go, and some it was just like, it's good for you, just do it. It's just to make sure that you're okay. So the language barrier and the education is a big factor, because they cannot express themselves how how they feel, or to fill out all these forms and all these other things that you have to do.
I agree. I think a lot of people of a Latin descent are very private about their health care. I've noticed they bring most of their family with them in the room. So we have a 2-person per limit in a room, and they have their grandma.
Another thing that I observed when I was working in that clinic was the amount of people with diabetes.
Diabetes is a very big problem.
Huge. I was
And high blood pressure.
totally surprised. And one of the doctors was explaining to me because the diet that they have, and so there were a lot of the men more than the women that went to that clinic. They were just checking, making sure that the blood level was okay. I mean, they give him all kinds of tools to check themselves and to make sure that they were okay. So a lot of the men went for that particular reason.
Yeah.
Which to me that was a surprise. I had no idea.
There's a very big learning curve in healthcare, at least from my experience with the Hispanic population. They just they don't know what's out there and available for them. And again, I agree with the fear of, and we try to explain to them, like, this is a safe place. We're here to take care of you. I don't care where you came from or where you're going. Just to make sure you're healthy, So I try to convey that as best as I can.
But that's it. I think that is the hardest thing. I think, one, the language barrier. I mean, they really don't understand.
Right.
And then even if you have some of those pamphlets in Spanish, some are not able to read.
Right.
So even there in Spanish, the information is not, they don't get the information because they don't know how to read it.
Right.
Now, fortunately, a lot of the children go to school and they begin to learn English.
Right.
So they come home and sometimes they can read and translate for the parents.
See, we're not allowed to use children as interpreters. And I think a lot of times people will say, no, I only want my son or my nephew. They'll bring like a teenager with them, and they want them to converse for them. But then they might be fearful of actually telling that 15-year-old boy about their pregnancy.
Well, that was one of the things, that I was also very surprised. They were very secretive. They go there and say, I have a pain here and a pain here, but I mean, when was your last period? What did you this, or that? I don't know. It was all very, nothing was clear.
Right.
Nothing was clear. Everything was like, oh, maybe, I don't know. And so there, and I think that is the fear of deportation. Is also the language barrier, and it is just education, I guess.
Yeah.
It's education, and it's very hard though. It's very hard because, I mean, can you imagine you're sick, you're in a foreign country, and you don't speak the language.
No, I would be terrified.
I mean, it is. I mean, it's just very, very, very difficult. Very difficult because you can express yourself how you feel, exactly how you feel, but you can't. So these people need a lot of support and a lot of help, and just to make sure that they know that they're not going to be deported, because that's not that's probably.
I tell them all the time, you're safe. You can tell me anything. It doesn't leave this room.
Yes.
Is there anything you could suggest as an ER nurse that I could do better or differently?
You're doing a great job.
Thank you.
No, I just think what you're doing is right. You reassure them that has nothing to do with paper, nothing that is on those papers or anything that they sign going anywhere.
Right. No, it's
because
just that we want to care for them.
They have the right of privacy.
Right.
And it's just to make sure that is okay, and for them to tell whatever the best they can with through an interpreter, to explain what the symptoms are and what are they feeling and what's wrong with them.
Yeah.
Because otherwise, how can you help them?
Exactly.
And usually also the circumstance and how this